So just as everyone saw, Dr. Zaghi went over my personal case with the tongue tie release, which was about 2 years from now. So during that time period, I documented just kind of daily up to 10 days, 1 month post-op, 2 months post-op, and 3 months post-op, just so that we can have it on record. It's a great tool to have for patients to kind of show them how much inflammation is normal, what does granulation tissue look like, and it's good to just document photos side by side. So I will go ahead and share the images here. Okay, so just as baseline, documented some photos. I took this photo the moment I recognized and I started working here and noticed that I had a tongue tie. This was actually brought up to me by my dentist when I was around age 7 or 8. However, at the time, the only question she asked me was about speech. She asked if I could roll my R's, and I said no. And she said if that ever concerned me, then it's something that I could get treated. She didn't have an understanding at the time of the impact it could have with maxillofacial development, with headaches, tension, or anything like that. So the more that I worked through the Breathe Institute, I realized that these issues were very relevant in my life. So at this time, I was recognizing that I had chronic headaches. This started even from early middle school for me. During that time, every time I brought it up to family, they said it was puberty. Went to high school, was taking rigorous AP classes. They associated headaches with that. Then I started moving on to undergraduate at UCLA, also taking rigorous hard classes, and most people associate the headaches with that. But even after I finished my education and I was just working, I didn't feel a lot of stressors in my life, I was still having headaches and taking ibuprofen almost every other day whenever leaving the office. And that's when I recognized that it wasn't just occasional headaches, but it was actually classified as chronic. I've always had a lifelong history of neck and shoulder tension. And also at this time, I started noticing that I was clenching my teeth a lot more. And the way I recognize this is just in the mornings, I would feel this tightness kind of in here. I'm not sure if I was grinding my teeth or anything like that, but I definitely felt that tightness. And again, I did always notice that I had a little bit of difficulty, especially with those R sounds. However, I was able to overcome it. I was still able to speak and articulate, and everyone understood me. So I didn't find it to be too much of an issue, but that's just what I was recognizing. Also went ahead and did a CT scan in the office just to reevaluate my airway, make sure that it was an appropriate size. I wasn't too deficient. So you can see here on the bottom right corner is my CT scan. So open airway. However, you can see that my tongue posture is just slightly low. Okay, so it's not fully covering in my palate there. Also as baseline, I went ahead and did a sleep study. I don't present with too much of sleep and breathing issues. I wake up feeling refreshed. I don't toss and turn throughout the night or anything like that. But I did recognize that I had slightly elevated RDI during this study. So these photos are demonstrating immediately before and after the release. So again, as you all saw, Dr. Zaghi did go into the genioglossus muscle. Every time you go into the genioglossus muscle, it does contribute to more pain in the recovery. So this is immediately after. I remember I took an ibuprofen, but even on my drive home, I was in a lot of pain and discomfort. So the rest of that night, I just took a tramadol. I think I had like a smoothie, and then I just so it was pretty sore for that very first day. Once the medication hit, it felt like everything was garbled and very swollen down here. But it is what I was expecting at that time. This is exactly 1 day after. Again, still pretty significant pain. I was taking ibuprofen around the clock every 4 to 6 hours. And then also with diet, it was still very hard to chew. I think at this time I even tried to manipulate, I think it was oatmeal inside my mouth, but it was still very challenging, very sore. I ate very slow. And then I had other things like yogurt and things like that. At night, just because I didn't want to wake up in pain or discomfort, I went ahead and took another tramadol on the second day. By day 2, the pain level wore off significantly. Just took ibuprofen around this clock, and now I was able to manipulate food a little bit better. And you can start to see that as some of the sutures started to fall out, the granulation tissue started to fill into those spots. By day 3, I returned back to work. Everything was totally fine. I was only sore, and I only recognized that I really had a tongue tie release when I was speaking a lot at work, or if I was chewing like during lunchtime or anything like that. And just for preventative and cautionary measures, I took an ibuprofen just in the morning, but I didn't take any more throughout the day, and I didn't feel the need to. Looking at the wound site here again, you can see as the sutures are continuing to fall out, more granulation is starting to fill. And at this time, we were using the Curaprox red surgical toothbrush. In this case, I did brush just a little bit prematurely, so that's what this redness is here. I could have left it alone. It wasn't overgrowing too much, but I did try and gently brush it, and it did cause some redness and inflammation. By day 4, again, you can see as the sutures are starting to come out, more of the granulation is filling in that spot. And at this time, it was a pain level of about 2. It's only sore when I'm purposely moving my tongue in certain maneuvers to do those exercises, to reach certain points in my mouth, to trace my palate. That's when I would feel that real stretch. And it was just very mild discomfort. I wouldn't even classify it pain, just a little bit of discomfort. With that granulation tissue, it was getting a little bit clumpy here. So I did just use that red surgical toothbrush and just gently brush that off. By day 5, very similar. You can see most sutures on the bottom and the top are now out. It's primarily just this one last suture here. And then I was eating normal foods. And it's very similar process of if it's looked a little bit gunky, I would brush it off a little bit. And even if I didn't have the surgical toothbrush, an alternative would be like a 2x2 gauze wrapped around the finger and just gently kind of brushing over the wound site. So that's what I was incorporating at this point in time. Okay, this brings us to day 6. Again, only sore or uncomfortable when I was doing the stretches. Again, I'm opening my mouth wide, I'm stretching the tongue, and that was the only time I recognized any type of mild discomfort. I was eating like normal, almost forgot I had a tongue tie release at this time, but I did recognize that it was starting to feel a little bit tight in this area where the granulation was kind of forming. So I actually started doing my manual stretches here. I didn't do it so much before just because if the sutures are in and you're stretching the tongue, it's a higher risk for ripping out the sutures. The mucosa is pretty thin. So I primarily waited for the sutures to mostly come out, and that's when I started doing those manual stretches. Okay, so day 7, exactly 1 week out from the procedure, very similar, no more sutures, that bit of granulation tissue. And if it felt tight, which is mostly in the morning, just because throughout the night, you're not moving the tongue, you're not speaking, swallowing, so it can feel very heavy in the mouth. So especially in the morning, I would do a really good manual stretch, and then things would feel a lot looser. And day 8, again, very similar in terms of the healing here. These slides are available to everyone. So if you actually go back and look at my mouth opening, especially when holding the LPS, you can see how much more I'm able to stretch and lift up the tongue. Just because as everything's healing, the more I was doing the stretches, I was able to open up a lot more. So then day 9, only sore with those manual stretches. Again, granulation pretty much came off now. It's just healing in that spot there. And then day 10, it looks pretty good. I did note that over this period of time, I started to feel a little bit more contraction. And this is something very important to always let patients know, that it is part of the whole healing process. So during the first week, it's about inflammation, discomfort, and managing that. During the 2nd and 3rd weeks, you go into that contraction phase where it feels tight. So that's why it's always so important to recognize the post-op therapy is so important, and also doing those stretches, checking in with your provider, and making sure that they have the appropriate stretches, oral massages to kind of break up and loosen up that tissue. This brings us to about 1 month post-op. I was still continuing as I was doing those manual stretches about 3 to 4 times a day. That helped with kind of widening my mouth opening. And I also recognized that it was a lot easier to eat and chew. I used to kind of pocket food in the backs of my back molars because my tongue couldn't reach. Now I could eat, I could clear out the food, and I just found that a lot easier to do. Brings us to 2 months post-op. This is when I started noticing my speech was a lot more fluid. I didn't stumble over my words as much. Again, this wasn't too much of an issue before, but just internally, I would notice certain words that I wouldn't have to enunciate as much anymore. At this point, I occasionally felt some tightness with the contraction, so I was still doing the manual stretches about 2 to 3 times a day. And then brings us to about 3 months post-op. This is when I kind of back. I still noticed all those improvements, speech fluidity, tongue mobility, and everything like that. That time period, I had maybe one headache, if at all. And this is coming from someone who was having headaches almost every single day and taking ibuprofen. These results have still lasted for me. I very rarely have headaches. And when I do, it kind of catches me by surprise. But I'm very, very happy that he did it. So that's for my case there. I'm just going to pause and see if there's any questions in that regard, and then read through any comments there might be.
Way to go. Thanks so much, Gloria, for presenting that case. I'm sure it's going to be super helpful for